Hi everyone, I'm Doug Beal. I'm an interventional musculoskeletal radiologist practicing in Oklahoma City. So low back pain accounts for the second greatest number of visits next to the common cold whenever you go to the doctor. It also is the single greatest cause of disability worldwide, so it's ubiquitously common. And whenever we have back pain, we typically experience it as pain and discomfort in our low back and hip region. It often radiates down our back, and we call that radiation sciatica. So not all low back pain is related to the low back. About 15 to 22% of that will be related to the SI joints. If you were to say one thing about SI joint pain, you were to say it's under-recognized and under-treated. The SI joint is related to the part where the sacrum meets the pelvis, and this joint right here is a very large joint, and it tends to be irritated and it tends to be overlooked whenever it comes to back pain because it radiates to this portion that of the back part of the low back where back pain typically radiates to. You know, it's seen in a number of conditions, primarily after you've had fusion. So if you've had fusion of your lumbar spine, anything that crosses where the spine meets the pelvis, it really predisposes you to SI joint pain and the development of that pain. You can also have SI pain related to, for women after childbirth, SI joint instability. And both of these often will need surgical correction. There's another form of SI pain that's just related to inflammation, things like rheumatoid arthritis and some of the seronegative spinal arthropathies, just the arthritides like psoriatic disease. These are treated with medication, so it's very important to distinguish the conditions that are treated with medication versus the conditions that are treated with typical biomechanical problems. Thank you for your attention.